Hi guys, in this video we will be discussing the various mechanisms by which blood glucose increases in our body that results in diabetes mellitus, and we will also discuss various mechanisms by which you can control this diabetes by using different classes of oral hypoglycemic agents. Selection of anti-diabetic drugs is very important. You have to understand what is the pathophysiology behind. In this pathophysiology we have different organs which are playing an important role. First is the pancreas, the other is muscles. Adipose tissue also has effect on blood glucose. Then we have got the intestines, and next comes the kidneys, and then the liver. So in this, we'll start one by one. We'll try to understand how these organs are increasing the blood glucose and also increasing the free fatty acid levels. That is a prime clinical feature responsible for diabetes mellitus. So to begin with, in case of pancreas itself can cause diseases in pancreas itself can cause diabetes by decrease in insulin release. So we have got certain drugs which will cause increased insulin release. These drugs we are calling it as secretagogues, and the classes of these drugs are the sulfonylureas, the glimepiride, and GLP-1 analogs, that is the semaglutide, liraglutide. Alright. Then comes the DPP4 inhibitor, dipeptidyl peptidase 4. Remember, dipeptidyl peptidase is an enzyme which is responsible for breakdown of incretins. So if you inhibit this enzyme, incretins are nothing but insulin increasing. The DPP4 inhibitor examples are the sitagliptin, the vildagliptin. DPP4 inhibitor examples like sitagliptin, vildagliptin are important in this. Next comes the liver. Liver can result in diabetes by increased glucose production. How does liver produce glucose? By two important mechanisms, that is glycogenolysis and gluconeogenesis. There are certain drugs which inhibit this process, and an important example is biguanides or metformin. Next, we discuss how kidneys can be responsible for increased blood glucose. If you can increase the excretion of glucose, then you can reduce the increased blood glucose levels, and the agents which are responsible for this are called as the sodium glucose like transporter 2, SGLT2 inhibitors. This transporter is responsible for excretion of sodium and glucose via the kidneys, and examples of these SGLT2 inhibitors include the dapagliflozin, empagliflozin, and etc. Then comes the next mechanism of action we'll be talking about is intestines. If you can reduce the glucose absorption from the intestines, you can reduce the blood glucose. So glucose absorption and free fatty acid released by an enzyme called as intestinal lipase are responsible for the clinical features of diabetes, especially the postprandial glucose. Examples of drugs which act via this route, via the intestines, are alpha glucosidase inhibitors. Here the example is acarbose. And next class of drugs which are responsible for the control of free fatty acid production are called as intestinal lipase inhibitors. Next, in the pathophysiology of diabetes, an important role is played upon by the adipose tissue. This adipose tissue is responsible for insulin resistance, and there is increased free fatty acids which are released via this adipose tissue. Drugs which inhibit this is thiazolidinediones, the pioglitazone, rosiglitazone examples. Alright, thiazolidinedione class can block this pathology. Next comes an important step in pathology responsible for increase in blood glucose is defective utilization of the glucose by muscles, again because of lack of insulin and insulin resistance. This is checked by drugs like biguanides, metformin, and thiazolidinediones. This completes the pathogenesis of hyperglycemia in case of diabetes mellitus. Hope you have enjoyed the lecture. If you have really understood it, kindly like, follow, share and subscribe. Thank you.